This is a sign in to the Intelligent Health Solutions. You can see a dashboard of the content management system. It shows the number of content, assets, and care plans and other components to the system. Click on Content. It's going to give a list of all the content items. I can come over here and click on View. This happens to be a video. You can see the metadata such as the review date, the name, the tagging information. We have a transcript of this video in both English and in Spanish. And you can actually see the video by clicking on this box here. And it pulls up in the asset category. And it'll actually pull up the video itself so you can actually play the video here. And of course we have the ability to add new content items. Each content item is defined by a unique code number, the sequence that it exists in the plans, the domains based on our health literacy model, so knowledge, numeracy, navigation, communication, and decision making. The level of the information, is it basic, advanced, or professional? The coaching strategy that it is aligned with. So we have a basic and then we have 4 unique coaching strategies. These include the listener. These are defining a strategy, not labeling an individual. The listener is designed for someone who's not very engaged, hard to motivate, less focused on content, more focused on challenges and reflections, getting the person thinking more about the health issue that they're dealing with. The motivators for the person who maybe wants to, but they're not sure how, maybe lacking some confidence. The directors for the patient who's really raring to go and wants a lot of guidance. And the expert is for the patient who really already has the information. They might be a professional themselves, certainly has a lot of information, but they need to be held more accountable and kept on track. The type includes the media types, and I'll show you some examples here in a moment. This shows what team within the American Heart Association is the owner of this content. The CHTI is our Center for Health Technology and Innovation. This item gives the review date, the care plan or multiple care plans that the item is associated with, and then the category. And this is a pretty long list, starting with our components of Life Simple 7, physical activity, nutrition, weight, tobacco, blood pressure, cholesterol, and glucose, but many other factors, medications and mental health, Life Simple 7, and just this is a growing list of health topics that can be used to better tag and identify the content item that we're looking at. And then we have both the name, the description, and the transcript of the item, and we can support multiple languages. In the assessment category, the assessment engine is a little bit different structure than the content information. The assessments require a question and a response. So here's an example. How are you feeling today? And it's, are you following your plan? Are you experiencing any symptoms? And are these new or worsening? And you can see the question view here and the choices. And you can see the JSON view or the code view. And you can follow the code. So even that list of symptoms, are you experiencing any of the following, is identified in this HTML tag here of these items. And of course with the assessment, we have the ability to create new assessments. We'll just create one on the fly here. And when we do that, you can pull up, and this kind of works like a Survey Monkey. You can identify the type of question, and you can then create very specific and very unique assessments based on that. In the care plan category, you can select the care plans, and you can simply step through each day of the plan. And as you can see, some days have more activities than others. These are configurable. The days can be changed around, and the contents within can be changed around and literally created as a new care plan. Just like we did with the assessment, there is the ability to add a new and unique care plan. The asset category, these are all of the raw files. So the videos, the images, the infographics, the articles, and they're stored in this file. And what this does, this is that same getting started video. The reason for this is then if the raw asset is updated, we can update it here. Maybe new information now exists. We update it here, and then this can be then connected to the content, items, and the care plans that this asset is associated with. Going back to the content structure now, within the care plan, there's a number of plans. There's a core plan, which is aligned with Life Simple 7. And then there are 9 condition categories, and these are patient-facing. Some of these are post-acute conditions like heart failure, cardiac rehab, CAD or coronary artery disease, stroke, atrial fibrillation, high blood pressure, cardiometabolic, and diabetes. We also have 6 mini plans. These are very focused and are shorter in duration. The mini plans are 4 weeks in duration, while the larger plans are 12 weeks in duration. And then finally, we have 9 professional-facing care plans. So the professional-facing is the content that is associated with on the professional side. So let me show you an example. You may have a heart failure patient, and this will pull up all the heart failure related information. That heart failure patient may also have other conditions like atrial fibrillation and diabetes. So these plans can be modular and designed to be very specific to the unique needs of the individual. I'm going to unclick these. We'll keep it at heart failure, and then you may want to include the professional facing side. So if you click here in the plan, you're getting both the patient facing side and the professional facing side. The professional facing would go to the doctor and the nurse. The patient facing side would go to the patient or user. You can also select from these categories. So let's say this patient, their priority is their physical activity. But you can add multiple categories here as needed. Coming over here to the coaching strategy, then you can then select which coaching strategy you want to use for this specific patient. And so then what this does then is it allows you to pull up a plan for that patient that's customized and very specific to their needs. A couple of other things on this screen. We have the level, and then we have the content type. So you can sort by video content. We saw an example of a video. We have very rich infographics. So you can pull up and select an infographic. Click here, and then this will pull up the infographic that you're looking for. We also have animations. So you can click here, and we have a number of heart failure animations, and the user can click next. And finally, the search filter can be used to look for other keywords. So let's say we're looking for chronic kidney disease. And it's going to pull up a list here. And you can pull up this content item. This happens to be an infographic on the professional side showing the recommendations for the treatment of hypertension in patients with chronic kidney disease. And so that's an overview of the content management system that supports the intelligent health solutions.